Good morning. Good morning to you, to Gisela, and to all of those following us in different parts of the world. Excuse me while I remove my face mask. Today, not all of the results are positive, especially in some aspects. But what they do is remind us of the behavior of the virus around the world and the situation in Cuba, which, given its complexity, can lead to difficult situations. As such, today, 269 people are hospitalized in Cuba. 8 are under observation. There are 169 suspected cases and 92 confirmed active cases, a high number compared with yesterday's figure. In our primary healthcare system, 397 people continue to be monitored by our professionals and specialists. Yesterday, over 3,000 samples were studied. 3,212 to be exact, were processed in our various molecular biology laboratories. 1,423 were processed at the Pedro Curi Tropical Medicine Institute, 591 in Havana's Hygiene, Epidemiology and Microbiology Center, 306 in Villa Claras, 263 in Santiago de Cuba, 325 in the Hermanos Almajeres Hospital Laboratory, 282 in the Genetic Engineering and Biotechnology Center Lab, and 22 in the Civil Defense Laboratories. Of the 3,212 samples processed, 37 tested positive for SARS-CoV-2 and COVID-19. This brings the total number of samples processed in the entire country thus far to 250,415, of which 2,532, or 1.01%, have tested positive for the virus. Yesterday, samples were processed from all of the country's provinces, especially Artemisa, which is dealing with a recent outbreak. 655 samples were studied from that province, 1,973 from Havana, 82 from Cienfuegos, 60 from Villa Clara, 90 from Granma, 95 from Santiago de Cuba. The 37 positive cases diagnosed yesterday are all Cubans. 26, or 70.2%, are confirmed case contacts. And, like always, I want to take a moment here to stress the importance of reporting and detecting everyone who, over the last 15 days, has come into contact with someone who has tested positive for the virus, because the highest rate of infection is found among confirmed case contacts, the majority of whom are asymptomatic. This brings the number of cases where the source of infection has been linked to a previously confirmed case to 2,182 people, or 87.6% of all cases. Of the 37 positive cases, 11 contracted the virus abroad. This reflects just how complex the COVID-19 situation is around the world, a topic which I will touch on later. As such, to date, 188 people in Cuba, or 7.55% of all cases, contracted the virus abroad. It was possible to determine the source of infection linked to all 37 cases diagnosed yesterday, while investigations are ongoing to locate the source of infection in 120 previously confirmed cases. Of the 37 positive cases yesterday, 20 are male and 17 are female, representing 50.4% and 49.6% of the total, respectively. As you can see, the rate is about the same, with only a slight difference between the sexes, especially when we consider that men dominate the statistics in other parts of the world. Only 29 of the 37 cases were asymptomatic, representing 78.3% of all cases diagnosed yesterday, and 55.56% of all confirmed cases in Cuba. The figure is similar if we look at the rate over the last 15 days, which stands at 57.7%. Of the 37 positive cases, the majority are between 40 and 59 years of age, with 20 cases or 54%. 7 children or individuals under the age of 20 tested positive for the virus yesterday, representing 18.9% of the total. This means that 288 minors or under the age of 20 have contracted the virus in Cuba, of which 277 or 96.1% have been discharged from hospital and made a full recovery. 5 people aged between 20 and 39 and 5 over the age of 60 tested positive for the virus yesterday. Of the 37 cases confirmed yesterday, 26 or 70.2% are from Havana, of which 14 are from the municipality of La Lisa, meaning an episode of local transmission has occurred there. Specific measures are being implemented on Block 180 and the Pulido Humaran Polyclinic, involving 4 blocks and 1,562 residents who will need to be tested for the virus. This represents the 5th outbreak we've seen in the country as a result of local transmission. As I was saying, 26 cases are from Havana, 14 from La Lisa, 10 are imported cases, none of which count toward the province's confirmed case rate. 1 case is from Habana del Este, linked to a previous outbreak there, and 1 is from Marianao. 10 of the 37 cases are from Artemisa, representing 27.2%, and all are linked to the recent outbreak in the municipality of Bauta. Finally, there was 1 imported case from the Isle of Youth. This individual recently returned to Cuba and tested positive on arrival to the country. As such, this case does not count toward the municipality's overall confirmed case rate. As you can see, Cuba's protocols benefit travelers and cases where the individual contracted the virus abroad. Yesterday, someone asked about people those returning to Cuba may come into contact with. Well, let me explain. These individuals travel by plane or boat and are transferred directly from the port or the airport to an isolation center in order to prevent contact with the population and avoid the spread of infection. Travelers are screened at the isolation centers, where the PCR test is also administered. Regarding the situation in different municipalities and the confirmed case per 100,000 inhabitants rate over the last 15 days, across the country's provinces, we can see that Artemisa continues to have the highest rate at 6.41, higher than yesterday's. Havana follows with a rate of 2.39, also higher than yesterday's. And then Villa Clara, with 1 case reported recently, continues to have a rate of 0.13. As such, Cuba's confirmed case per 100,000 inhabitants rate over the last 15 days currently stands at 0.76, higher than yesterday's. As I always remind folks, the imported cases do not count toward the country's overall rate of local transmission. Of the 2,532 total confirmed cases in the country, 92 are active hospitalized cases, and all of which are clinically stable. There are no critical or serious patients, a positive indicator and reflection of the hard work of our specialists and scientists. There have been no deaths to report in Cuba in the last 15 days. As we always mention, unfortunately, there have been 87 COVID-19 related fatalities in Cuba since the beginning of the pandemic, for a mortality rate of 3.44%, which, compared with the regional rate of 3.91%, places Cuba in 21st position in the Americas and 112th in the world. Remember, yesterday, Cuba was 111th. Well, today, Libya takes its place and Cuba moves down to 112th. As I always mention, 2 patients were previously evacuated at the start of the pandemic. 2 people were discharged from hospital yesterday from the province of Havana, a discrete and disappointing number compared with the number of positive cases diagnosed yesterday. This brings patients who have recovered from the virus to 2,351, or 93% of all positive cases. Unfortunately, the global outlook is negative and quite complex. As of midnight last night, COVID-19 continues to be present in the same 185 countries. There are currently 16,018,115 confirmed COVID-19 cases worldwide, after 256,052 cases were diagnosed yesterday. 5,559 COVID-related deaths were reported yesterday. Unfortunately, this figure isn't declining. This brings total COVID-19 fatalities to 644,832, for a global mortality rate of 4.02%. In the region of the Americas, which accounts for 53.8% of all COVID-19 cases worldwide, 152,507 new cases were reported yesterday, for a total of 8,620,775 confirmed cases. Yesterday, 3,775 people died of the virus in the region, for a total of 337,845 COVID-19 related fatalities in the Americas, and a mortality rate of 3.91%. The United States currently has 4,178,027 confirmed cases and 146,460 fatalities. Yesterday, the country reported 75,498 new cases. Brazil has 2,394,513 COVID-19 cases and 886,449 deaths. Meanwhile, India has 1,385,522 cases and 32,063 fatalities. These are the top 3 countries with over 1 million COVID-19 cases. Next is Russia, South Africa, Mexico, Peru, Chile, and the United Kingdom. These are the countries with the highest number of cases and, in some instances, the highest number of deaths. This is the information we have on the behavior of the pandemic in Cuba and the world.